Coming up today, artificial intelligence has been assisting in reading mammograms since the late 90s. And although the technology has come a long way, our specialists today explain why it might not be quite ready for prime time. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Would you want an AI to assist in reading your mammogram? That is a question some women are being asked when getting their annual screenings. How would you answer? Here is what some women told us.
I think as long as AI is accurate and they are catching everything that a radiologist would, I guess that's great. It would be immediate results and less wait time, but kind of makes the radiologist obsolete.
If it can compare mine to somebody who did have breast cancer, somebody who didn't have breast cancer, and it says, hey, it matches this way or that way, and then the doctor can then get involved and go, okay, yeah, this is the path we need to take, and that helped. And then if they can say that helped me better read your results because I had more to work with. It's not just me reading you and you alone.
I'd rather just have a doctor. Like, you know, if I have to wait, because I know going to the doctor's office is like a long time, I'd rather do that then. Because, I don't know, sometimes you can't trust AI.
If it can help with early detection, you know, that's really one of the most important things about a mammogram.
Well, you're clearly not alone with all of these questions. If this is your first time that you're hearing about AI-assisted mammograms, we're going to understand a lot more after hearing from today's panel. We want to welcome in Dr. Annalisa Winblad. She is the Director of Breast Imaging here at the University of Kansas Cancer Center. Next to her is Dr. Jessica Peterson, breast radiologist who is currently doing research involving AI-assisted mammography. Across from me is Dr. Carol Fabian. She is a breast medical oncologist and director of the Breast Cancer Prevention and Survivorship Research Center at the University of Kansas Medical Center. And she has brought along one of her high-risk patients. Kim Suter is a certified brain injury specialist and the owner of Advanced Neurobehavioral Services in Olathe. Thank you for being with us today. Kim, you are at the high risk for breast cancer, as we know, which is we know is a place that researchers believe that AI does show a lot of promise. What makes you high risk for breast cancer? Why did you enroll in Dr. Fabian's clinic?
I discussed with my medical professional my family history with breast cancer. My grandmother, her mother, and her sister all died of breast cancer at a pretty young age. And my medical professional was diagnosed that year, about a month before we had this discussion. And she said, I don't want you to have to go through what I went through. You need to go and see Dr. Fabian for preventative medical treatment. So I did, absolutely.
Wow, smart woman. Okay,
yes.
So as a high-risk woman, what kind of screenings are you getting? It's got to be more than just a mammogram, I take it.
That's correct. So I was referred to Dr. Fabian. I have had a mammogram. I also had a lot of family history that was, you know, the information was discussed. I provided that information. We went over that. Also, other cancers that the same family members had was a contributing factor that we looked at. And with all the information with my current health, I was referred to Dr. Fabian to be in a her preventative clinic.
Dr. Winblad, is 3D mammography the gold standard when it comes to screening?
Absolutely. 3D mammograms are better than traditional 2D mammograms. 3D mammograms allow the radiologist to find more cancers. 3D mammogram technology also allows the radiologist to review normal breast tissue more thoroughly, so we can call mammograms normal when they are normal and hopefully prevent more women from being called back for additional imaging.
So what difference does the screening type, when you said traditional screening versus the 3D, what difference does that make in reading the mammogram?
So a 3D mammogram, I would actually consider this as kind of the new standard, the new traditional. You know, historically, 2D mammograms are a single image. 3D mammography uses technology that creates kind of multiple low-dose X-ray images. So the radiologist is looking at a mammogram with kind of a 3D view. So you're looking at the breast tissue kind of in a more thorough review than a single image would provide.
So does everyone use 3D mammography? Is it fair to say that if that's the gold standard, should that be what you're always getting?
So these technologies are expensive. At KU, all of our mammogram machines offer 3D imaging, and across the country over the past 10 years, we're seeing that most facilities are adopting 3D technology, and all new mammogram units have that, but certainly we'll still see some 2D mammograms performed in the country and across the region.
Dr. Fabian, what concerns oncologists most about dense breast tissue, especially when it comes to reading mammograms?
Well, dense breast tissue can be a sign all on its own of an increased risk for breast cancer. The greater lobular and ductal amounts of tissue that you have, the higher that your risk, especially in someone like Kim, who has family history or other concerns. But the other problem is when a mammogram is dense, even a 3D mammogram may not allow you to look through that density and see a small cancer. So in cases where breast tissue is extremely dense, or if a woman has other risk factors who put her at a 10-year risk of at least 5%, or a lifetime risk of at least 20%, we usually advocate having a breast MRI in addition to the yearly screening mammogram.
So how could or would AI potentially help high-risk patients?
I will let Dr. Wimblad address that on a clinical issue. There are a couple of things that are just now being introduced where AI is attached to either a 2D or a 3D mammogram to help predict the 5-year risk of breast cancer. So with one trip to radiology, the radiologist could tell you as part of your screening mammogram, hey, maybe you ought to get to a high-risk clinic because your 5-year risk, despite maybe you don't even have family history, your 5-year risk indicates that you are at increased risk for breast cancer on the basis of AI characteristics and your mammogram.
All right, so Dr. Wimblad, let's get your opinion on this, because one person was worried that AI might make radiologists obsolete. First of all, just what's your response to that?
No, I actually don't think this at all. I don't think radiologists will become obsolete. With good AI tools, we're just going to become better at our jobs. And in fact, I think we're going to become an even more integral and critical part of healthcare delivery in the future if we use good tools and use them correctly.
AI-assisted mammograms cover a broad spectrum. There are many types of software being used in many different ways. The Susan G. Komen website has a page dedicated to the use of AI in reading mammograms to help patients better understand its use. Here at the Cancer Center, we have board-certified breast radiologists who are fellowship trained. So, Dr. Wimblad, of course, we don't rely on AI, but you do have them read the mammogram. Why?
So currently we are using and evaluating an AI software that provides decision support for mammograms. However, the AI tool does not read the mammogram. The radiologist interprets the mammogram and reviews the AI report during that interpretation.
So that's what you really want patients to understand.
Absolutely.
Dr. Peterson, you're doing research on AI-assisted mammograms. What are you studying specifically?
So I am looking at the numbers and types of breast cancers that are being identified both before we integrated the AI program and after we integrated the AI program to see if there's any differences or any changes that have been made. There's been a lot of studies that have shown the benefits of AI in reading mammograms, that it can increase the numbers of cancers that are found, which is great. However, every patient, every institution, every radiologist is very unique. So what may work for one situation may not work for others. So me and my team looked at 83,000 screening mammograms performed here at the University of Kansas Health System, both before and after AI. And we found that there was actually no difference in the numbers or types of breast cancers that were found. Interestingly, however, the AI program did miss almost 1 in 5 breast cancers that the radiologists found on the mammograms, which is very interesting.
Very interesting. What else are you hoping to determine, in the short term and possibly the long term when it comes to AI?
Really we want to provide the highest quality care that we can for our patients. So we want to make sure that any program that we're using is helping us achieve that goal. If it's not helping us achieve that goal, maybe we need to, switch directions. What else can we use it for? Like we said, there are a lot of different AI programs that are that are very specific in what they do, and so we just need to make sure that what we're using is the best and that helps us do our job the best.
The National Cancer Institute is watching AI closely, and researchers believe it has the potential to help in reading mammograms more quickly to help free up radiologists to prioritize the more suspicious results. So the question is that too futuristic? And I want to start with you, Dr. Fabian. What are your thoughts about that?
I think there are many areas of the United States as well as the world that don't have breast radiologists, or their breast radiologists have had minimal training, or they're just not reading a large number of mammograms. And I think to be really on your game, you have to be specialized in this. So I definitely think, particularly in underserved parts of the country or the world, that AI has a future. But quite frankly, if I have a suspicious lesion or no suspicious lesion on my mammogram, I want a qualified breast radiologist to be reading my mammogram.
Dr. Peterson, your thoughts on that?
I agree. I don't think it's too futuristic. They have been trials, especially overseas, where it's very common for 2 individual radiologists to read every single mammogram. They have shown that the AI program can essentially take the place of one of those radiologists. So if you free up an additional radiologist, that just means you can serve more patients. And again, underserved areas where people don't have access to fellowship-trained breast radiologists, it can be very, very helpful.
Dr. Winblad, not too futuristic for you?
It's not too futuristic to assume that AI is going to help us change the way that we deliver healthcare. Our goal is to adopt AI programs that make healthcare faster, more efficient, more cost-effective, and most importantly, provide higher quality care. Our job is to really identify which tools do that in different settings, and that's our goal. And when you think about, will this free up radiologists to do the complex care for just abnormal findings? The reality is, for a breast radiologist to be really good at complex or cancer imaging, you need to be even better at the normal stuff. You really have to understand the complexity of benign, normal disease and things like that too, in order to be the best at finding cancer. So as physicians, we just have to be really careful that we're adopting technologies that have the long-term goal that we're hoping for.
Dr. Fabian, you wanted to weigh in on something.
I think one of the biggest roles of AI is in research. I already mentioned that the FDA has recently approved this summer 2 AI programs that their goal is not to identify a cancer. It is to look at the changes in the mammograms over time that can tell you this woman is at high risk, and maybe that risk is changing. So for example, if you're on hormone replacement therapy and that benign mammogram that still doesn't have a cancer in it begins to shift, that is an indicator maybe you ought to get off, or maybe you ought to do something different. If you do clinical trials like I do, testing new medicines for breast cancer prevention, wouldn't that be wonderful that you don't have to do the fine needle aspirations anymore that Kim had to do, that we could use this kind of a tool to say, yes, we see changes here that have been associated with breast cancer.
Well, be sure to ask your questions. Use the chat on YouTube or Facebook, or you can email the Medical News Network. That information is right there on your screen. Kim, you've been shaking your head. I know you have lots to share about this. How did you feel about AI reading your mammogram?
I think that at first I was a little bit concerned, but I know that my doctor always has my best interest at heart, and I think that any tool that can be utilized to help women make the best decisions possible for their health and have the best possible outcomes, regardless if they do have cancer at the time or they, eventually do show something abnormal. I think that it was a little bit concerning, but being a scientific researcher, I am very willing to accept technology to help in making my decision, like helping me aid in my decision making for my best outcomes in my life.
I was going to ask you, not every woman, myself included, has this technology background that you have, a research background. So how, that must have been a little bit easier for you to digest the AI aspect of it, but not all women are going to feel comfortable with it because AI also has some negative aspects just out and about, you know, that we connect to it. And so how might we get past that? I'll ask the doctors here in a moment, but I want to ask you as a patient, how do we help women get past the negative aspects of AI and have them focus on the positive aspect of it?
I think understanding that, you know, a lot of people have a misconception that if AI comes in, it's going to replace my doctor. That's not going to happen. Me and my doctor make our best decisions for my health. I think using AI as a tool to help me with statistical analysis, with understanding probabilities, with understanding maybe what the best treatment recommendations would be, that is where I feel a lot more comfortable in knowing that myself and my doctor will use it as a tool to help me have the best possible treatments, diagnosis, and outcomes for my life.
Dr. Peterson, how do we make sure that patients understand that we're using AI at the highest of standards and that's how we're researching it and applying it?
By watching shows like this, by doing outreach, and just reassuring patients that our goal is always to provide the highest quality care, and if AI can help us do that, we want to make sure we know that.
How do we make sure AI is seen properly in the field of reading mammograms and making sure that women feel comfortable in having those conversations?
Absolutely. Well, I think you described this perfectly. It's a tool. So AI is not reading or interpreting a mammogram. It's a tool that helps the radiologist, maybe do an extra evaluation of tissue or think about, the, results from the AI report, and that we're doing that to give patients the best care and adding more tools into our, a large array of tools to help us do the best job that we can.
Well, in fact, some studies put AI accuracy as high as 87%. Dr. Fabian, is that threshold? Did that cross the threshold for you to make sure that you would trust it as a tool?
As a standalone tool, no. And that was a question I wanted to ask Dr. Peterson and Dr. Lindblad. Okay, let's say that you think somebody's mammogram is fine, but AI gives it a very high probability of there's a breast cancer there. What do you do? Are you more likely to recommend biopsy if you're kind of on the fence as to whether this is a benign lesion or not?
That's a fantastic question. It's one of the reasons that Dr. Peterson's research is more important. She's actually not just looking at, are we finding more cancers? Are we recalling more patients unnecessarily? Are we doing more biopsies that we otherwise would not have done? Is it influencing us in the way that we provide medical care or decision making for our patients? And at KU, we actually don't look at the tool until after we've read the mammogram, because as we're doing research, we don't want it to influence the way that we provide care. And if you look at our patients who are, complex, a lot of high-risk patients that have had breast cancer, our AI tools actually give a lot of patients abnormal report cards when they're very normal, because they've had surgeries and distortions in the breast or tissue marker clips, or AI even calls them silly things. So that's our job as a subspecialized radiologist, is to look at those findings and see, are those really real? Is that a real finding? And it may make our job even more challenging, having to then deal with these abnormal reports in patients that are normal. So auditing and validating these tools is so incredibly important.
Well, that brings me to my next question. How well trained are experts like yourself in reading these mammograms at places like our cancer center? Because it's not done everywhere in that way. And how does that impact results and treatment paths for patients?
So at KU, our breast radiologists are fellowship trained, several years of training in breast imaging, and we're dedicated to breast imaging. So they're the best. The best of the best. I wouldn't have anyone else read my mammogram. But this conversation about AI is really important. Different radiologists in different practice settings, even breast specialists and academic versus community or a solo practice might use AI tools very differently, and they might perform very differently in different practice settings. So we really have to make sure that they work in the practice setting that you're in, for the patients I'm taking care of. So we really have to test these, and that's one of the really important parts about being an academic radiologist and a researcher, is making sure that we are setting the standard for what these tools do and how they're used.
Kim, did you want to comment?
I feel the same way. I think it's really important that, you know, we look at tools that we have, and I think doctors and different clinics can read them differently, but I think if you have a trusted medical facility like KU that you go to, I know that I can trust the doctors here, and I know that they're using these tools ethically, and I know that they would protect my confidentiality, and I know that's something that students that I work with have brought up. Like, I want, if I'm having AI help me just doing something diagnostically, how do I know that my privacy is protected? And this is something that I trust in KU. I know that they do that.
That's great for people that have access to places like ours, but what if they don't?
Well, if they don't have access to a place like KU, I mean, these tools may work really well in different settings. I always recommend going to a facility that has, you know, trained radiologists reading your mammograms, that has 3D technology, so that you're getting the best technology that you can when you're getting screening. Like you said, I mean, the most important part of screening is early detection, and, you know, finding cancers at an early stage when they're treatable, looking for changes on mammogram. And you really do have to look for facilities that offer you the best.
Could somebody get a mammogram one place and have it read somewhere else?
You can have, so if you have a mammogram at one location and you decide to come for a second opinion or for your next mammogram at a facility like KU, you absolutely can. And in fact, for those patients, those are the one type of patients we can't read their mammograms sometimes in real time if we don't have their imaging from the facility at the time of reading. It's incredibly important that we have comparison mammograms. That's how we get the best results and look for the smallest changes. So we will ask for the mammograms from the outside facility when we interpret any mammogram.
I want to get to some questions from our viewers because we've got a couple of really good ones. Joellen wants to know, where do women over the age of 70 fit into this whole subject? Who wants to jump in on that one?
I'll jump in on
You
that
jump
one.
in, Dr. Fabian. Go after it.
You know, we used to say that if you're over 70 or 74, somewhere around there, you don't really need to have any mammograms anymore. And that is being called into question, even for people who are at average or population risk. But for people that are high risk, forget that idea. If your life expectancy is, especially as 10 years or more, which for most women it is nowadays, you should continue to get a mammogram at least every other year.
Jeremy wants to know, how does AI struggle with dense breast tissue? Or do the accuracy rates stay roughly the same?
There have been studies that have shown that AI isn't influenced by density, that the AI can essentially see through the dense breast tissue and find equal rates of cancer in all densities.
We touched on this a little bit before, but let's go over it again, because Jean wants to know, what about the problem of AI making up answers sometimes?
That's absolutely a problem. You know, that's why you need someone to interpret it. I mean, we'll have AI do silly things sometimes, you know, mark a nipple and call it a mass, or, you know, so AI absolutely has errors, and that's expected, you know, so that's why it's so important that a radiologist is reviewing the information on the scorecard or the AI report to make sure that it's adding or helpful.
So that's why you're not going anywhere.
No,
not
yet.
You're here to
Not
stay.
yet.
You're here to stay. Cindy asks if AI-assisted mammograms cost extra and if they're covered by insurance.
AI software tools at KU, we do not charge for these tools. We do not bill insurance. They're very expensive tools, and across the country, you will see some facilities charge a fee for the use of AI. You know, AI is expensive, and this is one of the reasons it's so important that we validate it. You know, most physicians are not being reimbursed for AI tools they're using. We really have to make sure that they are helping us make healthcare more cost effective, better, higher quality, and saving us money down in the long run, so that we're not making, you know, adding to the problem of healthcare cost.
Lastly, Quinn is asking if all AI is created equal. Where and how is it learning to read mammograms?
Every single AI program is going to be different. So the AI program is basically trained on a set of mammograms. So the AI program will be shown mammograms that we know have breast cancer and we know that are normal and don't have breast cancer. So it will look at tons and tons and tons of mammograms until it has kind of learned or has an idea of this is what cancer looks like. So that specific AI program only knows what cancer looks like on the mammograms that it has seen before. So then when it goes out into practice, it can then look at a new mammogram and say, hey, this area looks like a cancer I've seen before, so I'm going to mark it. But like I said, every AI program is very different and trained to do a very specific task, and it's been trained on different sets of data. So you want to make sure that the AI program that you're using has a wide variety of data, that it's not biased in any way.
And I think that's particularly important, what you just said, for the high-risk patient. Most of these AI programs are trained on what we call population risk. People that are not at increased risk for breast cancer. So unless an AI program has some specific piece of it that's really trained in high-risk women, I really wonder about the same thing. I'd also like to comment on the cost. Some of the newer programs that I talked about that were just FDA approved for predicting risk, not looking at a cancer, the charge for those are substantial. They can be as much as $200 added to your mammogram. So know the cost if you're asking for an AI program to predict your risk.
Dr. Fabian, what do you want the big takeaway from this conversation to be today?
I think just what our radiologists have told you, that AI is a great tool. We use AI in research all the time. AI helps the radiologist not miss anything, but it cannot be used standalone at this particular time.
Kim, what's the big takeaway from your personal story?
I think it's really important to trust your doctor. I think early screenings are extremely important, but I think using AI as a tool to assist your doctor can be something that we should all be open-minded about, because if it can help my outcomes and it can help other people with statistical analysis, with treatment, with all these different things, I think we need to keep an open mind and trust our doctors and use it as a tool to assist and not take over for our doctors. It's going to be something that I will never get rid of my doctor, but I want it to be utilized. I have an amazing doctor, so I will never let it replace my doctor, but I want to be open-minded.
I know Dr. Fabian's hard to replace.
Yes, it's not possible.
Not possible. And just finally, what message do you have for people who have this deep family history of breast cancer or any type of cancer? What message do you have for them about really staying on top of things and maybe having, as we kind of get into the holidays, this is a good time to talk to people about their family history of cancer and getting screened?
Don't be scared to talk to your doctor, and know that screening is extremely important, and that if you see something that's abnormal, don't be scared to say something. Talk to your doctor immediately. I have concerns. Here's what my concerns are. What do you think we do next? So you have to talk to your doctor about any concerns you have, and make sure that you feel comfortable and confident in reaching out to your medical professional to help guide you in the best possible screening and mammograms and things that you need diagnostically. I think it's important.
Great having you this morning.
Thank you
so much. Dr. Peterson, what's the big message here today?
Well, I think we have to realize that AI is a very powerful tool and it can be used to do amazing things. However, we need to be vigilant and make sure that AI is working with us to reach a common goal. We want to use it to provide the highest quality care. And if it's not doing that, then we need to be aware of that.
Continue the great research. Thank you so much. Dr. Winblad, what's the big takeaway?
I think AI is going to change the way that we deliver healthcare. And the biggest takeaway for me is that physicians really need to be involved in testing and validating these AI tools to make sure that we're using the right tools that make our healthcare better, that make our delivery of healthcare better, and not add to the complexity or cost of healthcare.
Always great to have your insight. Thanks to our great panel of guests today. Fantastic discussion, very important. Thanks to our viewers for being with us today. Have a great one. We'll see you back here tomorrow.
How well do you sleep? A new study finds it's not about how many hours of sleep you get, but your sleep profile. I'm Alexis Del Cid. On the next All Things Brain Health, we explain the 5 patterns of sleep that researchers say affect brain activity in different ways.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now everywhere podcasts are available.